Good afternoon, class. Today, we will present a training video on assessment and interpretation of height, weight, and BMI presented to you by John and Jared. The purpose of BMI is to determine a patient's anthropomorphic status, monitor nutritional health, evaluate growth patterns, and or assess obesity-related health risks. When measuring for height, have the patient remove their shoes and stand straight with heels, buttocks, shoulder, and head against the wall as much as possible. Their eyes should be level with the horizon. Once the patient is situated, mark from the crown of the head to the nearest 0.1 centimeter or 1/8 of an inch on the measuring stick. Record this number for later use. Some precautions that you should be watching out for is ensuring the patient is not slouching or leaning, and being cautious with the elderly or patients with kyphosis. In this clip, I instruct John to remove anything bulky from his pockets that would obstruct him from standing flat up against the wall and removing his shoes to get an accurate reading of his height. When measuring for weight, instruct the patient to remove their shoes and any additional heavy clothing that they might be wearing. Have the patient stand centered on the scale without holding onto any of their surroundings and wait for the reading to stabilize. Then record the weight to the nearest 0.1 kilogram or 0.2 pounds. Some precautions that you should watch out for is supporting balance impaired individuals such as the elderly, and avoid using non-calibrated home scales for clinical purposes. In this clip, I instruct John to remove any bulky items he might have in his pocket and also to remove his shoe so we can get the most accurate reading of his weight. I then adjust the scale to the nearest 0.1 kilograms or 0.2 pounds and then take his measurement. After you have collected both your patient's weight and height, use the formula applicable to the units that you collected your measurements in. Once you get your calculation, round the result to the nearest decimal place. BMI classification is categorized into the following. Underweight is less than 18.5, normal is 18.5 to 24.9, overweight is 25 to 29.9, and obesity starts at 30 and then is further divided into class 1, 2, and 3. This classification guide helps guide clinicians but is not diagnostic on its own. Using the measurements we collected from John, his BMI would be 27.5, which would categorize him in the overweight category. Clinical indications for using this test would be for routine physicals, pediatric growth tracking, monitoring chronic diseases like diabetes or hypertension, and screening for undernutrition or obesity. These measurements provide a baseline for health and intervention. Contraindications and limitations around BMI may be that it is not appropriate for all populations. It can be misleading in athletes with high muscle mass, older adults with height loss, or those with edema. Patients with spinal deformities may not accurately measure for height, and always consider the clinical context of your patients. For precautions, use care with patients who have balance issues or mobility limitations. Be sensitive when discussing body weight and avoid stigmatizing language. Ensure consistent technique and regularly calibrate equipment to improve accuracy. For clinical consideration, remember, BMI is a useful screening tool, but not a diagnostic measure of health or body composition. It should always be used in conjunction with other clinical assessments, such as hip-to-waist ratio, physical activity level, metabolic markers, and patient history and physical examination to get a broader picture of your patient's overall health. In summary, height, weight, and BMI assessments are simple yet powerful tools in clinical evaluation. These are our evidence and sources that back up the BMI's strengths and limitations. When done properly and interpreted thoughtfully, they contribute meaningfully to patients' care. Thank you all for watching and have a great rest of your day.